Do you get ball of foot pain when walking? Pain in the ball of your foot is referred to as metatarsalgia, is the medical word for it. And basically that just means pain in this bone in your foot. But there are various different things that can cause pain in the ball of your foot or metatarsalgia. And it's not just one thing. You can have pain in the ball of the big toe, which is probably the most common, but you can also have pain in the balls of the little toes as well. I'm Dr. Dave Candy, and in this video, I'm going to explain the various things that can cause pain in the ball of your foot when you're walking, and some strategies that you can use to help relieve pain in the ball of your foot when you're walking. Now we're going to go through a couple different things in this video. The first thing is going to be shoe causes of pain of the ball of the foot and some solutions you can use to improve your footwear. The second is going to be some hands-on treatments that you can do to your own foot to help relieve pain in the ball of the foot. And then the third is going to be functional things like exercises and changes to your walking that you can use to walk more comfortably without pain in the ball of your foot. Now, shoes are a major cause of pain in the ball of your foot. And largely shoes that are too narrow, that have a pointed toe box or just too narrow in the overall width, or high heel shoes. In those cases, your toes are jammed into a narrow space and you're up on your heels, which puts a lot of pressure on the ball of your foot. Now, your foot is normally shaped like a fan. The toes splay out, but when you are in shoes, most shoes have a toe box that goes into a point at some part. And so shoes don't necessarily make your foot function the way that it should function in nature. And so if you do have pain in the ball of your foot, you want to make sure, one, that you have shoes that are properly fit, both in width, that it's wide enough for your foot, as well as that you're not jamming your toes in, which can cause something called hammer toes, where you're extended at this point, which puts your ball of the foot in a very prominent position, and then you're kind of flexed down in these toes here. Now, if you have pain in the ball of your foot, you also probably want to err towards the side of wearing flat shoes. Heels, particularly high stilettos or things like that, are not good if you have pain in the ball of your foot. Now, additionally, it can be helpful to wear orthotics or arch supports that help maintain the natural arches of your foot. And you actually have three arches of your foot. One that runs along the inside, which is what most arch supports support. You actually have a longitudinal arch that runs along the outside of your foot as well. And then a transverse arch is the third arch, one that runs side to side over the top of your foot. So normally your big toe and your little toe should be the farthest down towards the floor, and the other three toes kind of dome over the top. Now we'll go into a little bit later the biomechanics that affect the things that could cause those various arches to fall. But largely, if you are having pain in the ball of your foot, you probably want wider shoes so your toes aren't being jammed together. That can pinch on the nerve in your foot, something called Morton's neuroma, and it can also cause a hallux valgus or a bunion in your foot. You can see I've got a pretty prominent one there, and when you have a bunion on your foot, it takes your toe, which is normally supposed to post and keep your foot from flattening too much or overpronating when you're walking, and it allows you to flatten your foot down too much. So to see that, when you're walking, your big toe should normally stop your foot from flattening out. It should act like a post to keep your foot from flattening out too much. But if you've been wearing narrow shoes that cause a bunion, it can cause you to overpronate or pronate longer than you should because there's nothing there to stop that pronation. Now, a late effect of that is that because you're overpronating, you end up putting more pressure on that big toe side of the foot. And so wearing shoes that are too narrow, causing a bunion, can create big toe ball of the foot pain. Now, some self-treatments that you can do if you have pain in the ball of your foot are largely going to focus at a couple different joints. First is actually the big toe joint itself. You should have about 70 degrees of extension from the metatarsal to the toe. And so you want to be able to get that toe to bend backwards. And sometimes that means you actually have to take the metatarsal and pull it down that way and stretch it up this way. So you get sufficient extension through that toe. Additionally, if you have a bunion, you want to pull the toe outwards and stretch it back to its normal alignment where it's aligned up with the metatarsal and not pointing inwards. So pulling out like that. Now, depending on how much bone you have built up, you may never get it back to a perfectly normal alignment, but you do want to try to pull it out so it recreates that post and prevents you from overpronating when you're walking. Now, additionally, you want to check underneath the midfoot. You've got a joint here called your mid-tarsal joint, which kind of joins your rear foot and your forefoot. If you overpronate, that mid-tarsal joint can get too flexible and some bones can start to drop down into the arch of your foot. So you want to kind of run your fingers along there. Feel if there's anything that sticks out or is kind of sore and tender. Then just place your thumb on it and pull that first metatarsal or the big toe down around it like that. And again, that kind of helps you regain the normal function of that first toe. Next is for the transverse arch of your foot, of the arch that goes over the top of your foot. For various reasons, particularly if you overpronate, that makes that mid-tarsal joint too flexible, and you can lose the transverse arch that goes over the top of the foot here. And that's necessary to have normal biomechanics of your foot. So you want to take your fingers and kind of put them down the middle of your foot, and then fold the foot around it to reform that transverse arch. Now, ultimately, you're going to need to strengthen the muscles within your foot to help maintain both the longitudinal arches that go front to back in the foot, as well as the transverse arch that goes side to side in the foot. And so here's how you do that. When you're walking in high heel shoes, your big toe joints are extended where it puts pressure on the ball of your foot. And what that does is it makes the muscles that flex your metatarsal phalangeal joint or the ball of toe joint, it makes those muscles weak. And so what you want to do is think about making a short foot where you're pulling the ball of the foot towards the heel of the foot. And what that does functionally is it raises the arch of the foot and lifts you up that way. So you want to make what they call a short foot, dome the arch, and then practice balancing on one leg like that. And try holding that. You may kind of feel like your foot's cramping up if you're not used to doing that. If it does happen, just take a break for a moment and then reform that short foot or dome the arch. And then practice holding it again. Now, largely you want to keep your foot muscles active when you're walking. And by wearing shoes, particularly high heel shoes, those can make your toes weak or lazy because you don't need to use your toes as much to grip the ground for balance when you have shoes on. So even if you do wear orthotics to maintain your arches, which isn't necessarily a bad idea, then you still want to strengthen the muscles inside of your foot to help dynamically maintain your arch when you're walking. Now, next, you also want to be able to push off and maintain that arch of your foot. When you walk, again, as you pronate, that makes the foot a little bit more flexible and it allows you to absorb shock. But then you need to be able to come out of that and push off and make your foot a rigid lever as you go to push off. Now, if you've got a bunion here and you stay in pronation too long, then your foot's flexible as you go to push off, and it puts more pressure on the metatarsal heads or on the ball of the foot. So to practice strengthening, and you probably don't want to do this necessarily while you have an acute ball of foot pain, because this does put a little pressure on the ball of your foot, but eventually you're going to need to be able to do this. You want to stand facing towards a wall. Again, make an arch in your foot or create a dome in the arch, and then try to raise up on your toes while still holding that arch in the foot. You don't want to allow your arch to flatten out like that, where you're pronating as you're going up. You want to maintain that supination or arch lift, and then go up on your heels. Start out by holding on to the wall, but eventually you want to be able to maintain your balance and do this without holding on to anything. So those are the strengthening exercises to help make your foot stronger, to take care of pain in the ball of your foot. Additionally, you want to make sure you have enough flexibility in your ankle and in your calf. Because if you don't have enough flexibility in your ankle and calf to take a step through, that causes overpronation of your foot because your body needs a way to get around that ankle joint to take a step forward. And pronation is one major way that that happens. Now again, that's not good if you overpronate, because when you overpronate or stay in pronation too long, it makes your foot too flexible and it makes the mid-tarsal joint too flexible. It can cause a collapse of your arches, and it makes your foot not be a stiff enough lever to go when it comes time to push off. So make sure you have enough flexibility in your ankle joint and in your calves. You can do that just by stretching up against a wall like this. You want to make sure you do that short foot or doming of the arch as you're doing this, and hold for about a minute or so. And so that ensures that you don't overpronate and make that arch or the midfoot too flexible, causing the arch to collapse. Now, finally, what can you do as far as footwear to help relieve ball of foot pain? Well, in the acute case, putting a metatarsal pad or just a little pad that goes behind the toes of your foot can be a good idea to help take pressure off the ball of your foot while you're still having acute pain. Orthotics can be helpful, particularly if they are custom made for you. If you're having ball of foot pain, usually normal off-the-shelf orthotics just support the inner arch. So you want to make sure that you have something that is designed to work on the forefoot, not just control arch support and control the rear foot. And then additionally, using wider shoes, for example, Ultra brand shoes have a wider toe box where it's actually fan-shaped like your foot rather than cone-shaped like most normal shoes. And then finally, using toe spreaders that go around your feet to spread your toes out and put them in their more normal position can be helpful, particularly if you have a Morton's neuroma, a pinched nerve in your foot causing your ball of foot pain, or if you have a hallux valgus. What you do with these is you just put them between your toes like this, and it helps spread your feet out wider, particularly if you have a bunion on your big toe or if you have a pinched nerve or a Morton's neuroma in between your third and fourth toes. So hopefully you did find this helpful to learn how to relieve pain in the ball of your foot. Now, if you need more help for pain in the ball of your foot, I do recommend seeing someone in person, particularly an orthopedic or a sports physical therapist who understands the biomechanics of the foot. The biomechanics of the foot are incredibly complex, and most medical doctors and a whole lot of PTs really don't understand it because there's so many joints and so many muscles and so much intricacy with the way that the ankle and the foot work together that you really need someone who understands that well. And if you happen to be in the St. Louis area, we'd be happy to help you out with that here at More for Life. And no matter where you're watching this from, if you found this video helpful, give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.